Did you know that Parkinson's disease is the fastest growing neurological condition worldwide? Aging is an important risk factor, but aging alone does not explain what we are seeing. Many patients develop Parkinson's disease at a relatively young age. Historical evidence suggests that Parkinson's disease was much less common before industrial pollution began in the 19th century. Today, we know that environmental exposures play a major role. Industrial pollution, pesticides, and certain chemicals have been strongly associated with Parkinson's disease. One important example is trichloroethylene, or TCE. TCE is a solvent used in many industries and has been linked to Parkinson's disease through groundwater contamination and occupational exposure. It can be found in products such as adhesives, degreasers, carpet cleaners, paint and paint removers, stain removers, wood finishes, and dry cleaning agents. This is why TCE is often called an invisible cause of Parkinson's disease. Another major contributor is pesticide exposure, especially chemicals like paraquat and glyphosate. Multiple studies show a higher prevalence of Parkinson's disease in areas with heavy pesticide use, such as vineyards in France and tulip fields in the Netherlands. More than 20 studies have linked pesticide exposure to Parkinson's disease, and paraquat in particular has been shown to approximately double the risk. Despite this, paraquat is still used in the United States. Paraquat is not banned in the US because regulators prioritize controlled agricultural use and risk mitigation over a precautionary approach. Even though paraquat is extremely toxic and has strong epidemiologic links to Parkinson's disease, many other countries have decided that the risk is unacceptable and have banned it. Certain occupations also carry a higher risk of Parkinson's disease, including farming, welding, and pest control, where exposure to toxic chemicals is common. Repeated head trauma, such as in soccer or football players and boxers, is another recognized risk factor. If you want to reduce risk, minimizing exposure to pesticides is important, and if you already have Parkinson's disease, continued exposure to pesticides may accelerate disease progression, as shown in a study published by Schneider and colleagues in Environmental Health in 2020. Interestingly, people who smoke cigarettes are less likely to develop Parkinson's disease, although we are not sure why. This may relate to differences in dopamine signaling. In other words, people who smoke have more dopamine available at baseline or a possible effect of nicotine, but this does not mean you should start smoking. Smoking has many serious health risks and is not a preventive strategy. There is good news: diet matters. The MIND diet and the Mediterranean diet are associated with a lower risk of developing Parkinson's disease. People who follow these diets after diagnosis often have a better prognosis. And finally, exercise is one of the most powerful protective tools we have. High-intensity exercise has been shown to protect brain health and improve symptoms in people with Parkinson's disease. There is strong and growing evidence supporting this. If you found this video helpful, please like, share, and subscribe to the channel for more evidence-based information on brain health and Parkinson's disease.